Hello, I am Tony Bonelli and I am the practice manager here at Santa Rosa and Rohnert Park Oral Surgery. Our team is honored to be working with you to achieve the oral surgery results that you desire. To ensure optimal comfort and recovery after your surgery, please follow these simple post-operative instructions. This video will cover important information regarding proper post-surgical care for wisdom teeth extraction. If you have been scheduled to have your wisdom teeth removed, it will be important to follow these instructions exactly as we present them. Discomfort is normal after the extraction of teeth. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, start taking ibuprofen, also known as Advil or Motrin, as instructed by your doctor at the time of your surgery. If you are asthmatic, do not take ibuprofen unless you have tolerated it in the past. If your pain is not controlled by the ibuprofen alone, take your prescribed narcotic in addition. Ibuprofen and your prescribed narcotic can be taken together. Be certain to take your pain medicines with food. This will help prevent nausea. Remember, narcotic pain medicine will impair your judgment and reflexes. Gauze pads should be placed directly over the extraction site and held in place with firm biting pressure. Proper placement will help you not swallow blood, which can make you nauseated. Replace the gauze pads every 20 to 40 minutes. When the gauze pads have little or no blood on them, they are no longer necessary. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for up to 24 hours. Do not rinse on the day of surgery. It may prolong your bleeding. Begin saltwater rinses the day after surgery and continue for 1 week. Rinse with warm salt water 6 to 8 times each day. To make the saltwater solution, dissolve a ½ teaspoon of salt into a small glass of warm tap water. Swelling is normal after surgery and is a major cause of post-extraction discomfort. Swelling typically peaks by the 3rd day and then starts to resolve. It can be reduced by the use of an ice pack. Apply the ice pack to the side of your face for 10 minutes. Transfer it to the opposite side for another 10 minutes. Continue icing the face for the first 24 hours. Do not freeze the skin. Ice packs are useful for the first 24 hours only. Also, keep your head elevated on 2 pillows for 3 to 4 days. These measures will not eliminate swelling, but they will help to reduce its severity. To allow blood clots to form undisturbed, do not eat for 2 hours after surgery. Start with clear liquids such as apple juice, tea, or broth. Gradually ramp up your diet as tolerated. Always cool down any hot foods or liquids during the first 24 hours. If you were sedated for surgery, do not eat fatty, creamy, or oily foods, as these foods may cause nausea. You should eat only soft food for the first week. For example, soups, eggs, mashed potatoes, and meatloaf are fine. For 2 weeks, or 8 weeks if you had lower wisdom teeth extracted, do not eat hard, crunchy, or very chewy food such as European breads, pizza crust, steak, jerky, nuts, or popcorn. To help prevent dry socket, do not use a straw for the first 3 days after surgery. Begin brushing your teeth the day after surgery. It is important to brush all of your teeth, even the teeth and gums are sensitive. Bacterial plaque and food accumulation near the extraction site will delay healing. Do not smoke for at least a week. Smoking will increase your bleeding, impair healing, and may cause a dry socket. Unless told otherwise, do no vigorous physical activity for 3 days following your surgery. Physical activity increases your blood pressure, which will cause an increase in your swelling, pain, and bleeding. You may gradually increase your activity, such as jogging or tennis, 5 to 7 days after your surgery. If you have any additional questions, please call our office. Our staff is happy to help you in any way we can to make your post-operative recovery successful. Thank you.